Hello, welcome everyone. Thank you for joining us for day 2 for another session of the Virtual Pharmacy School Fair. We'll get started in just a couple of seconds. Okay, let's go ahead and get started. So welcome everyone to this session, and thank you for attending. So this session, does an ambulatory care pharmacist work on an ambulance? It will describe the roles and responsibilities of an ambulatory care pharmacist, and will review the opportunities to explore and prepare for a career in ambulatory care pharmacy. We're joined by two wonderful speakers. We have Gina with us and Melissa. Before they get started, I just want to remind everyone to please put any questions that you have for our speakers in the chat or in the Q&A box, and we will get to those hopefully at the end of the session. If not, no big deal, because you can always go to the Thomas Jefferson University booth and chat with our speakers a little bit more after the session. So without further ado, I'll hand it over to you all to get started.
Thank you so much, Danielle. Good morning, everyone. We're very excited to be here this morning, and I'm extra excited because I get to partner with one of our Jefferson graduates, Dr. Melissa Gregorio-Kowal, and she is now working as an ambulatory care pharmacist. So I thought it would be fun for us to get to talk to you today about an area of pharmacy that is often confusing for students when they come to us, because it's not necessarily an area of pharmacy that a lot of people have had face-to-face interaction with. That being said, it's a growing area of pharmacy and I think very exciting area of pharmacy. So we are here to dispel some of the myths about this area, and we'll talk to you about the definition of what ambulatory care pharmacy is this morning, as well as talk to you more about the role of an ambulatory care pharmacist, and then the steps you can take to become an ambulatory care pharmacist. And finally, what are some of the ways that you can prepare for a career if this sounds like an exciting option for you in the field of pharmacy. So before I dive into what exactly an ambulatory care pharmacist is, and does an ambulatory care pharmacist work on an ambulance, I'll give you just a quick synopsis of my background. So I am an associate professor at Thomas Jefferson University. I have taught there for many years, Melissa, of course, being one of my former students. I did a PGY1 residency in pharmacy practice, and then did a PGY2 residency in ambulatory care. And we'll talk more about those in a little while, and have worked at a variety of different clinic practice sites with some different patient populations throughout my career, but now focus on teaching and other academia pursuits full time. And I'll let Melissa tell you a little bit about herself as well, and what her background has been so far in her early career.
Thanks, Gina. It's nice to see everybody here today. So I started as a student at Jefferson, and then after I graduated, I did a PGY1 residency in the hospital with some AmCare focused rotations. And then I did a second year of residency in ambulatory care, and it also had components of population health, which kind of goes hand in hand with that field. So it's really nice to have everybody here today, and hopefully we will inspire you to go into AmCare.
All right, so does an ambulatory care pharmacist work on an ambulance? The answer to that question is no. And you may have started to get that idea as you perhaps have read the description of our program. And that is a very common misperception, because it sounds like that is exactly where an ambulatory care pharmacist would work. But no, we do not work on ambulances. In fact, when we talk about what we like to accomplish with our patients, it's the exact opposite scenario of someone that needs an ambulance. We want to be talking to our patients, digging deep into their medication use and adherence. So when you have an emergency and need an ambulance, not a good time to talk to an ambulatory care pharmacist. So the ambulatory part relates to the definition of ambulatory, which connects with really being able to walk. So our patients are those that can come to us. So we see patients in the outpatient setting. So if you think about where you might be going for your own medical care, whether you're seeing a primary care physician, for example, or maybe you see specialists for some other chronic diseases, pharmacists work in those same exact settings. And we are there to be able to provide specialized pharmacy services to those patients that are able to ambulate, to walk to us, to come to us in that setting. So it's really in contrast to pharmacists that are seeing patients in the hospital where maybe they are not ambulatory at that time because they are experiencing a more acute illness. So within the field of pharmacy, there is a board of pharmacy specialties. They provide certification in certain areas of pharmacy, one of those being ambulatory care. So they have a definition for pharmacists who work in ambulatory care. They define it as pharmacists who provide integrated, accessible healthcare services for ambulatory patients in a wide variety of settings, including community pharmacies and clinics. So that's something that we'll stress throughout our conversation, that ambulatory care pharmacists are not just only in the clinic setting, but there are many community pharmacists who are doing lots of work kind of under the ambulatory umbrella. So there are a lot of different practice sites that you can go into if you're interested in ambulatory care. I think some of the key parts of that definition really ring true as far as what ambulatory care pharmacists focus on. So that integrated piece is very key because we work alongside other healthcare professionals and really try to look at the patient's medications in all together. So we are not isolated to focusing on just one prescription, for example, at one time. We want to take the bigger picture into account, all of the things that are going on with the patient, their different diagnoses, their different medications, as well as some of the other aspects of their lives that may be impacting their care. So maybe that is their ability to afford their medications. It might be their ability to get to a pharmacy to pick up a prescription. It may be their health literacy, their ability to understand the directions related to their medications. So we're helping to look at all of those different pieces and really helping to figure out how can we get the patient to be in the best state possible when it comes to managing their medications and then ultimately their diseases. The accessible word is also very key. So we mentioned that to engage in ambulatory care pharmacy, these are patients that can come to us, but we need to make sure that we are accessible. So we are positioned in outpatient practices, for example, right alongside the other healthcare professionals that the patient may already be seeing, as well as I mentioned, offering some of these services as part of what a community pharmacist can provide as well. And we know that there are pharmacies on every corner. So being able to provide ambulatory care services in a community pharmacy, of course, makes us really extremely accessible. So ambulatory care pharmacists are going to engage in direct patient care. The umbrella of things that we cover is pretty vast. So first and foremost, chronic disease state management. So we will talk more about some of the structure of our clinics and the specific things that we do, but helping to manage diseases that patients are going to themselves be dealing with for sometimes the rest of their lives is going to be a big role that we play. Some examples of those diseases are diseases like diabetes, high cholesterol, high blood pressure, pulmonary diseases like asthma, There are, of course, many others beyond that, and the area of ambulatory care pharmacy that you go into may dictate which specific diseases you play more of a prominent role in. Of course, as pharmacists, we are going to be heavily involved in medication therapy management. So that may be helping to determine which medications are the best for a patient for a particular chronic disease. We know that there are guidelines that help to recommend medications for patients, but we really zone in on what makes a medication the right fit for the right patient. So we also look at not only how well medications work, but how safe they are for a patient. We help to identify medication-related problems. So if you yourself have ever experienced an unwanted side effect from a medication, or maybe you have an allergy to a medication, maybe you had something going on and you weren't being treated at all, you needed a medication, so the need for therapy. So we look through patients' medical history as well as their medication list, and try to identify if there are any problems related to their medication that we can help solve. Ambulatory care pharmacists also play a role in health maintenance. So thinking about all of the things that you need to be on top of to make sure that you're preventing diseases. So that may be helping to recommend a vaccine, for example. And then a huge part of an ambulatory care pharmacist job is going to be patient education. So we are going to be the ones who provide the counseling when a patient perhaps starts a new medication. We provide education on different disease states, on different non-pharm things that connect to your health, like diet and exercise, as well as helping patients understand the importance of adherence. And those are just a few examples of all of the different education that we provide. So I mentioned as part of the integrated part of being an ambulatory care pharmacist, working with other healthcare professionals. So in the outpatient setting, we will work alongside a whole host of other healthcare professionals that may be doctors, nurses, physical therapists, nutritionists, social workers, anyone really that you can think of that might be involved in healthcare. If they are working in the outpatient setting, we're working alongside with them. And then finally, another big part of the overall ambulatory care pharmacist role is going to be patient advocacy. So we often are the ones who are spending the most time with a patient talking about their medications. And that puts us in a really key role to then be able to advocate for them when it comes to those medications. That may mean helping them get their medication changed from something that's really hard for them to remember to take every day to something that's simpler. It may be helping to advocate for them to be changed to a medication that is more affordable for them if they're having trouble paying for their medications. So there's lots of ways that we gather information from our patients and then are able to advocate for them to help make improvements in their overall care. So where specifically do ambulatory care pharmacists work? So we mentioned, of course, already that it is primarily focused in the outpatient setting. That can be both in more of a clinic setting and, as I mentioned, more of a community pharmacy setting. So within the outpatient clinic setting, you may find ambulatory care pharmacists focused on primary care. So you'll find us in internal medicine or family medicine clinics. So ambulatory care pharmacists who are focused in those areas are going to take a more general approach. We're going to be looking at all of the patient's diseases. We are going to be looking at their entire medication list and really focusing on all of the different ways that we can help improve care when it comes to their drug therapy. But you will also find ambulatory care pharmacists who have decided to specialize. So they may be focused in more of a specialty clinic. So for example, within infectious diseases, you may find an ambulatory care pharmacist who is working in an HIV clinic or a hepatitis C clinic. You'll find ambulatory care pharmacists in cardiology focused more on high blood pressure, for example, oncology, pain, diabetes, geriatrics, pediatrics, If you can think of a medical specialty, there are pharmacists who work within those specialties as well. Then within the community pharmacy, there are certain things that community pharmacists engage in that are related to ambulatory care practice. That might be medication therapy management, which is the process of going through a patient's medication list with them, looking for those drug-related problems that I mentioned, identifying areas for improvement, and helping to advocate for them. Doing things like providing immunizations in the community pharmacy setting. That falls under the ambulatory care pharmacy umbrella as well. And then a new area of ambulatory care pharmacy is population health, which is looking at all of the different health determinants and how they are impacting drug therapy at more of that population level. And this is an area of pharmacy that Melissa has embarked on working in, and she'll tell us a little bit later more about some of the things that she's doing in that area. So in terms of some of the responsibilities for an ambulatory care pharmacist, I've mentioned some of them along the way already. So probably our primary role is going to be the top bullet here, which is to provide drug therapy management. So when we get a referral for a patient or are pulled in to collaborate on seeing a patient, typically the provider, the doctor, for example, that wants to get us involved, wants to do so because we're the medication expert. So often these are patients that need that extra help with their drug therapy. So in providing drug therapy management, we are helping to look at the medications that a patient's on, making sure that that is the right assortment of medications for them. So we'll be checking for to make sure that those medications are working for them, that they're not missing any medications, that they are not experiencing any unwanted side effects from those medications, that they're able to remember to take all of those medications, that they could afford those medications. Anything and everything related to the management of those drugs, we will play a role in helping our patients. Next, providing disease state management, we may get referrals to help very specifically with a diagnosis that a patient has. Excuse me. So for example, one of the disease states that I've been heavily involved in managing throughout my career is diabetes. With diabetes comes typically many medications. They can be overwhelming for patients to manage, and often they need a lot of fine tuning and adjusting. So a pharmacist is the perfect person to help with that fine tuning. So if someone's on insulin, for example, they may be following up with their doctor maybe every month, every 3 months, every 6 months to keep their diabetes well controlled. But they may come to see me as the ambulatory care pharmacist for more frequent visits so that I can help them track their blood sugars and make those small dose adjustments to their insulin. Some other responsibilities that we have are to provide patient education and counseling. We will do that, of course, related to drug therapy, but also we will provide education related to those non-pharmacologic things that impact drug therapy. So that may be diet, it may be exercise. We may help them to better understand their disease states. Diabetes is another perfect example there, where I'll sit down with a patient and help them understand what happens when they eat something that has a lot of sugar in it. How does that impact the sugar in their body? And then how do their medications help to counteract the sugar that they've ingested? We'll also provide education on device use. So a lot of our medications are not just taken by mouth. They are taken in forms like an inhaler for pulmonary condition like asthma. We have injectables, and we can help our patients to understand what are the appropriate steps to use those different devices. We actually also perform physical assessments. So that's something that a lot of people don't necessarily know a pharmacist gets involved in. So we may be listening to a patient's heart, checking their blood pressure, listening to their lungs. We do diabetic foot exams that may not sound too appealing to everyone, but we will check and make sure that patients' feet are healthy. And these are things that, as part of a PharmD curriculum, you learn in school. So it's really exciting to be able to do them once you're practicing as a pharmacist. And ambulatory care is definitely one of the areas that you get to take a lot of what you're learning in your lab courses during your PharmD program. And then you actually get to put it all in action. We will also get involved in facilitating group visits or patient education classes. So this is a nice way for us to provide drug information or device teaching or disease state teaching to more than one patient at a time. It also creates a nice camaraderie amongst patients who are going through similar things together. So an example of a type of class that we might do for multiple patients would be a smoking cessation class. We are also always available to answer drug information questions. So typically the other healthcare providers that we're working with, they'll pop in and ask us anything and everything related to drugs. So we'll answer those questions often quick on the spot while we're in clinic, for example. And then sometimes there are questions that, we'll spend some more time doing some research on, and we're able to get back to them. And then finally, an additional responsibility is to help our patients navigate their prescription drug costs and their coverage. So we'll get a lot of questions about whether or not a certain drug is covered by a certain insurance. So we can check on that. For patients that don't have insurance, helping them to figure out what will be the most cost-effective ways to get the treatment that they need for their medications. So next up, we want to touch on the way that some of our practice sites may be set up. And there's a lot of variety here, and it connects back to the different responsibilities that we just discussed on the previous slide. So depending on the responsibilities that you have in your particular practice site, your setup may be a little bit different. So a lot of ambulatory care pharmacists work by referral. What that means is that the doctors, for example, that they work with, identify patients that would really benefit from talking to us. So they'll refer the patient to us, and then that patient makes a one-on-one appointment with the pharmacist, and then we're able to meet with them and come up with an evaluation and plan. And then we consult back with the person that referred the patient to us, and we will continue to move forward working collaboratively to help that patient with their medication needs. We also might have visits with multiple healthcare professionals in one day. So for those patients, they will have a long appointment scheduled, and they will be able to see us. They'll be able to see their doctor. Maybe they'll see a social worker. Maybe they'll see a nutritionist. And then all of us are behind the scenes collaborating to get them all of the different things that they need. We also might have the visit right with some of those healthcare professionals. So you might actually have a visit where you are going in with the doctor that you work alongside, and that you see the patient together. And that, of course, is a little bit time saving for the patient, and it helps with ease of collaboration as well. We'll have those group visits and classes that I mentioned for things like smoking cessation. So there are pharmacists who will have their practice site set up with kind of one of these. Maybe they do all of their appointments by referral. And then there are others that do a mix. So maybe you have some days where you're getting referral appointments, other days where you're running group visits, for example. So one of the big questions that we always get is, can ambulatory care pharmacists write prescriptions? So the answer to that is that it depends. It depends on the state that you're practicing in. There is the opportunity for collaborative practice agreements in some states, which means that you're working very closely with a doctor, and you have an agreement where you are able to make specific recommendations for certain drug classes. You might be able to get involved in lab ordering with those collaborative practice agreements. So there is a lot of synergy that can be created depending on the state that you're practicing in. There are also states that permit standing orders. So you may be working in a place where there are orders for certain medications that can be enacted once certain parameters are checked. And then finally, there are places where pharmacists do have prescriptive authority in the ambulatory care setting. Veterans hospitals, the clinics that are associated with the VAs are an example of a place where pharmacists are able to go ahead and write the prescriptions for those medications that they're recommending. So that's something, once you get into pharmacy school, you'll learn more about. and it'll be very specific to the area that you are practicing in, depending on where you are in the country. So we wanted to talk to you a little bit about why we went into ambulatory care pharmacy. This, of course, is going to be a very personal decision for you if you hopefully pursue a pharmacy career path. There are so many different avenues to go into. So for me, I went into ambulatory care pharmacy first and foremost because when I was a PGY1 in the hospital, the patients that I was seeing so frequently were in the hospital because they weren't getting the right care, or maybe they were getting the right care, but they didn't understand something about the drug therapy that they had been prescribed for their disease states in the outpatient setting. And I was seeing patients that were there for hyperglycemic emergencies. Their blood sugars had gotten way too high. Seeing patients for hypertensive crises. Their blood pressure had gotten way too high. For asthma exacerbations or COPD exacerbations. These were patients that didn't understand how to use their inhalers properly for their asthma treatment. So I was really motivated to put myself in a role where I would get to help patients before they got into the hospital. And the ambulatory setting was the right place for that. So I wanted to be able to help patients understand how to use their medications, know when to use them, understand why they were taking them. And I thought that that was a spot where I could really make a difference so that they wouldn't end up needing to go to the hospital. I also really liked talking to patients. You can imagine that's part of why I also went into academia. I like talking, I like teaching, and I wanted to be able to build those relationships with patients. There is also a fair amount of autonomy that comes with ambulatory care pharmacy. So if you like to be able to work more independently, that is something that is definitely a big part of being an ambulatory care pharmacist, coupled with also being able to interact with those healthcare professionals. So you get kind of a good mix of being able to work on your own, but also having the team to chat with as well. So I'm going to turn things over to Melissa to talk to you a little bit about why she went into ambulatory care pharmacy.
Yeah, so a lot of my reasons are similar to Gina's. My family has a strong history of diabetes, as well as high blood pressure and high cholesterol. So growing up, I saw a lot of that. And once I got into pharmacy school, I was able to help my family members with managing their disease states a little bit more, giving them tips and things along the way that they never knew. So that steered me into the field. And then as I went on rotations throughout pharmacy school, and our last year of pharmacy school is all rotations full time, I really, really liked working with providers, patients, being able to give them little tips and tricks along the way that no one else has really had the time to tell them sometimes, or it's gotten missed. So that was really something that drove me this way in my career. And then also, like it was mentioned earlier, you do a lot of counseling on non-medication therapy, so diet and exercise and disease state teaching, a lot of preventative things. So I really enjoy that, along with the good work-life balance. You really don't have to work any holidays or weekends because your office is usually closed, just like the doctors wouldn't work, nights, holidays, stuff like that. And lastly, I get to see a whole lot of different disease states, which keeps it fun and interesting.
Great. We're running out of time here, so I'm going to skip ahead and skip past what our day-to-day looks like. You're welcome to come to our Jefferson booth if you want to hear more about that. But I just wanted to quickly go through how do you become an ambulatory care pharmacist? So first and foremost, obtain your doctor of pharmacy degree. You'll want to become licensed, of course, in your state. You can consider completing residency training. That is a little bit more of a direct path. So there is specialty residency training in ambulatory care, or you can focus on the area that you want to practice in. For example, if you want to be in ambulatory care and cardiology, you could do a cardiology residency. There is a board certification exam that you can take to become board certified in ambulatory care. So that helps your credentials. Then finally, getting involved in other special things that ambulatory care pharmacists can do is always helpful. So being trained to administer immunizations, for example, doing point of care testing, learning more about population health, all of those things are helpful. And then we'll just wrap up here, things that you can start to think about doing in pharmacy school to position yourself to go into ambulatory care. I'll let Melissa talk through this one with you, since she more recently was able to do some of these things. So Melissa, just really quickly, if you want to highlight maybe some of the things that you found helpful to focus on in pharmacy school.
Yeah, so definitely taking advantage of all your rotations, finding things that you might be interested in. They offer, I know Jefferson at least offered a ton of different types of rotations that you can try out. Electives in school as well are definitely helpful. There was like a diabetes elective at Jefferson where you got to kind of know more about what the day in the life of a diabetic feels like and get more perspective. And then also taking advantage of any certificate programs. We worked on like a medication therapy management one, I believe in lab. So things like that are helpful. And also if you're able to get involved in any professional organizations, I did like the American Pharmacist Association, American Hospital Society of Pharmacists, anything you're interested in, but it helps to kind of just give you more information about that field.
All right, well, thanks everyone. We, I think, are out of time, right, Danielle? But if anyone has questions for us, feel free to come to our Jefferson booth or reach out via email. Hopefully now you're clear on where ambulatory care pharmacists work, and maybe we've excited you to explore this area a little bit more.
Thank you both so much for this great presentation. Yes, we're unfortunately out of time for questions, but please visit their booth to chat with them a little bit more. Our next session starts in about 15 minutes. Time, please visit the expo and chat with our lovely representatives. Thank you both so much for this presentation, and I'll see everyone else in the next one.
Thanks, everyone.